time for DocTalk Radio, brought to you by Gilbert Hospital and Florence and Anthem Hospitals. I'm Dr. Ann Borik, board certified in internal medicine, and I'm here to keep you up to date on the latest information pertaining to your health and well-being.
All right, it is that time again for another fantastic episode of DocTalk Radio with Dr. Ann Borik. Welcome, Dr. Borik.
Joe, how are you?
I'm good. How are you, Dr. Borik?
Good, good. Welcome to DocTalk Radio, sponsored by Gilbert Hospital and Florence Hospital at Anthem. For our listeners out there, I'm actually broadcasting today from Pittsburgh, and I'm looking out the window, and it looks like a snowstorm out there. It's freezing here. So I miss being in Arizona.
You know, ironically, Dr. Borik, it snowed here this morning.
Did it really?
Isn't that crazy? We had torrential downpours, and it snowed in Florence all over the ground, and lots of it.
That's amazing. You know, we don't see snow in Arizona too often. But, today I want to, talk a little bit about cold-related emergencies. So this really fits perfectly, thinking that, I'm here in Pittsburgh and it snowed in Arizona. So who would have thought that? But, there are some emergencies and real emergencies related to cold. And I want to just talk a little bit about frostbite, because frostbite can be a real medical emergency. Those of you listening, I want to give you a phone number to call in, 480-745-1033. I'd love to hear from you. You can join the chat. Certainly we can talk about any topics that you want to talk about, but we'll start out talking a little bit about frostbite, because frostbite is very real, and as I said, it can be a real emergency. It occurs when the tissues become frozen, and particularly exposed parts of the body, the nose, the cheeks, the ears, the fingertips, the toes. And really what happens is the body auto-regulates itself when we're, out in the cold, and the brain senses that the temperature, and the core temperature drops. It turns on this regulation where vasoconstriction of blood flow to the extremities start to decrease. The body always wants to protect the inner organs, to preserve life rather than function. So that's kind of an automatic situation that happens in the body. And, ultimately that can lead to loss of limb, loss of fingertips, loss of toes, and so forth. People that are at risk for frostbite are people who are outdoors, homeless people who are hunters or hikers. Alcohol, interestingly, can be part of the whole process. If you're drinking and you're outdoors and you don't realize that it is cold, you can find yourself with pretty significant frostbite. But what is frostbite? Well, there's different types. There's a superficial and there's a deep type of frostbite, and the symptoms kind of can present with burning, numbness, tingling, even itching, and it appears white or frozen on the surface of the skin. When it's the superficial type, it could actually be reversed if you seek medical attention sooner. But if it gets to the deep, tissues where it actually turns blistery, appears blackened or dead, you can lose your tissue, you can lose your fingertip. Joe, I don't know, have you ever met anybody that had suffered from frostbite?
I knew a hiker one time that did some pretty big mountains that lost a couple of fingers.
Yeah, it's very, very real. And the treatment is rewarming. Quick medical attention is absolutely vital. But swelling occurs, and it's really kind of interesting that ice crystals form in the space outside the cells. And then water is lost from the cell, and then the cell dies. And sometimes even damage to the lining of the blood vessel can occur. And when that happens, you just think about, blood flow is inhibited, and then you can develop blood clots, and all kinds of different, complications can result from frostbite. But one thing to kind of keep in mind is that if you do find either yourself or somebody that is suffering from a suspicion of frostbite, you really want to seek medical attention sooner rather than later. Like putting the hands under hot water is probably not a good idea, because rewarming of the tissues is really should be done under medical supervision. If you do it in a gradual manner, you can actually cause more damage. So the recommendation is get them out of the cold, take any wet clothing off, dry, warm, and then beyond that, let the medical let the medical team, start the process. And really what would happen if somebody were brought into the hospital, as a hospitalist, we deal with emergencies in the hospital. Usually we can do like a stepwise approach of rewarming the body. For example, warm IV fluids would be one modality. Oxygen, airway warming is another modality. We can sometimes even put a nasogastric tube into the stomach with like a lavage of warm water. So there's a lot of different ways that that the body can be rewarmed. Even sometimes like a dialysis, just to warm the blood in some people that are emergently
we had
hypothermia.
We had a call in from Janet from Kenosha, Wisconsin, who just wanted to let us know that her aunt Millie, 72 years old, has slight dementia. Actually wandered outside, and it was not snowy. It was very cold, and there was a cutting wind, and she ended up with frostbite. They thought she was going to lose, possibly some fingers or even a hand, but ended up recovering fully. They did not know she was frostbitten because of the dementia, and some of the things that she had was like memory loss and things like that, and they weren't completely sure until they actually realized that there was no feeling in the fingers, and the frostbitten had taken place.
Mm-hmm. Janet, thank you for calling, because that is really exactly what can happen. Sometimes the elderly, sometimes people who are on medication for mental illness, don't realize, and even early Alzheimer's or dementia, people can find themselves, in the situation, and frostbite, and can set in. And so really thank you for sharing that, because I think it's important for our listeners to hear that. The other treatment modalities, anti-inflammatories, what happens is when the tissue dies, fluid seeps outside of the cells. And so what we see are blisters. Blisters can occur on the surface of the skin, and then swelling. And an anti-inflammatory medication is oftentimes what can be used. Now, hypothermia, which is just a medical term for low temperature, is something that causes, or frostbite can be the result of hypothermia. And a normal body temperature is 98.6 Fahrenheit, 37 Celsius. When you're hypothermic, it really doesn't take a whole lot. The body temperature just dropping a couple degrees down to 95 degrees Fahrenheit is really the definition of hypothermia. And what happens is the brain immediately, the hypothalamus kicks in, and blood flow begins to diminish to the extremities. And so, that's basically what now causes of hypothermia can be inadequate clothing, being outside too long, heat loss from unprotected surface, from the not wearing a hat, not wearing gloves, those kinds of things can be a big part of it. And so when you find yourself in that situation, and as I'm looking outside in the snowstorm here, I think about, the anatomy of breathing, because the body is an amazing machine, Joe. We have some really neat techniques that we can do to preserve heat. Wear a hat, wear gloves, but just the way that you breathe is another way to protect your airways from the damage of cold air. And so the nose, actually the anatomy of our nose, was really designed to help humidify and warm the air as we breathe in, so that the air that comes in to the lung is actually humidified, warmed, and prepared for the lung, so that it doesn't damage the trachea in the lung. So really one of the messages that I want to get out to those people listening today out there who are maybe exposed to the cold, is if you find yourself walking in the cold weather, pay attention and try to breathe through your nose, because that will really help to minimize damage to the trachea and to the lung. Breathe in through the nose, and then as you exhale, you can certainly exhale through your mouth. But the nose is a real benefit when it comes to protecting the body from cold air. Does that make sense, Joe? I think we have talked about that before. It absolutely, it's so important.
It absolutely does. We had Victor call in from Phoenix, who said he actually lost 3 toes doing Everest, and he wouldn't have lost the toes, he found out, but he continued to walk on them and increase the damage to the frostbitten toes, I guess. And he says he just wanted to let people know that, if you do get frostbitten and you feel like your skin is kind of waxy and numb, don't use that. Like he said, like what you said, warm them up right away, get indoors, and don't use those fingers or toes, because that cost him to lose some of his.
That's exactly right. To continue to walk on or, use your hands or the part of your body that is frostbitten can actually result in worse damage, because what you're doing is you're using up and requesting flow to that part of the body when in fact you don't get flow. So continued damage can occur, and so that's really a great point.
What would continue the damage, Dr. Borik?
The trauma, just walking on it, using the hand, so that if you do sense frostbite, don't wait 2 or 3 days. Get in to be seen to make sure that in fact it's not down to the tissue. If it's superficial, a lot of times it's reversible, but once it gets deep, and you lose the sensation, and blood-filled blisters occur, and it becomes blackened, and the tissue looks dead, there's not a whole lot that can be done to reverse that. And so, it's kind of like a diabetic walking on a diabetic foot that's been traumatized. You lose the sensation, you don't feel pain, and when you don't feel pain, that kind of is a trigger where it really is more serious than not. As long as you have sensation, that's actually a good thing. If it feels itchy, if it feels tingly, if it feels burning, the preservation of sensation is actually a good thing. Once that's lost, a lot of times it's irreversible, and that becomes a problem. A lot of times people who are dealing with frostbite, who ultimately, require surgery, infection is a very, very real possibility. And so, blisters occur, you don't have blood flow, the skin is not intact, infection sets in. And once infection sets in, it's very, very difficult to treat because you don't have blood flow. And so oftentimes, what we call osteomyelitis, which is an infection in the bone, can occur. And, and ultimately that becomes a whole nother treatment modality with IV antibiotics and then amputation, just in and of the treatment of osteomyelitis. So that's a problem. So the message really is to be aware that this can occur and seek help earlier rather than later. So I want to talk, do you have any other questions there?
No, but I'm going to grab a line right this second.
Okay. Well, while Joe's getting the phone, I want to just open up and talk a minute about Raynaud's, because there is a phenomenon called Raynaud's phenomenon or Raynaud's syndrome, which basically is an overactivity of the walls of the muscle of the artery, and it causes spasms in the artery. Oftentimes we call it white finger disease, and there's many causes of Raynaud's phenomenon. The most common cause are related to the autoimmune process in the body: lupus, rheumatoid arthritis, connective tissue disease. But there are other causes that a lot of times people really don't think about. For example, thoracic outlet syndrome. There's something called thoracic outlet syndrome where the nerve, as it comes out from the spinal cord, is compressed as it's coming out of the thoracic outlet area within the structure of the body. And if there's a compression on that nerve, it's going to cause an inability of the smooth muscle lining the artery to act normal. And oftentimes that overactivity or the inability of the muscle to regulate itself causes spasms. And it looks like, white finger disease, if you will. Things that can bring that on: cold is the most common, but interestingly hot. If you're exposed to either hot weather or a hot cup of coffee, or, you burn yourself with hot water, that can trigger this vasospasm in the artery. And it can cause what's called Raynaud's phenomenon. Oftentimes it can be very painful. But other things that can cause it, for example, hypothyroidism. We've talked about hypothyroidism before, and the thyroid really is a kind of houses the metabolism of the body. And if you have an underactive thyroid or an overactive thyroid, you can have many different symptoms in the body, one of which can be a Raynaud's phenomenon, which oftentimes is overlooked. Medications that often can make this worse, for example, if you have a tendency toward Raynaud's vasospasm or white finger disease, or if you live in the cold and you go out and your fingers turn white at the tips, that's a vasospastic process called Raynaud's. Birth controls can make that worse. Smoking can make that worse. Sudafed, interestingly, in the cold weather, decongestant, you go to the store, you get some of these decongestants, and they cause vasospasm, and they can actually make Raynaud's worse. And so just keep that in mind, if you have a tendency toward this syndrome, that those are the things that can really make it worse. Even vibration, for example, there are workers that are working out, doing construction and so forth, jackhammers, just the vibration of that work-related process can make Raynaud's worse. So those are some of the things that we need to think about. So are you there?
Yeah, absolutely. I was talking... Oh, go ahead.
Yeah, do you have a caller?
Yeah, I was talking to Ted Jacobson out of Florence, and he wants to know, is there something you can recommend to help circulation? He was telling me about his legs, and they're always freezing cold. He's 72 years old, he's type 2 diabetic, and he does not really partake in any exercise. And he's having some real super freezing legs, and he feels that it's a circulation problem, a lot of itching.
Mm-hmm. Well, I mean, it's actually textbook. And what was his name, Jay?
Ted Jacobson from Florence.
Ted Jacobson, okay. Well, first of all, diabetes is definitely a risk factor for, atherosclerosis, poor circulation. So, number one, we certainly want to make sure that the diabetes and the blood sugar is under control. Just the fact that you feel that your feet are cold tells me that you probably have some component of poor circulation. And the things that I would want to recommend, and certainly, I can't make a diagnosis over the phone, but number one, to avoid smoke. If you're a smoker, that is absolutely the worst thing that you possibly can do, because it increases like 40 times the risk of peripheral vascular disease, and it can actually make it worse. So that's absolutely the first thing that you want to do, is avoid smoking, avoid anything that's going to cause vasoconstriction to the blood vessels. Movement, exercise, really, really important, especially if you have diabetes, to help increase blood flow and circulation. But the question that I would want to bring up was, do you have a narrowing? Is there actual structural narrowing that needs to be, treated? And, an aspirin, sometimes antiplatelet therapy is recommended. Sometimes even the first step would be to do a Doppler flow to see the waveform. And it's a very non-invasive way to test circulation to the lower extremities. And if that circulation is actually not good, then there are some other modalities that they can actually go in there and open up the circulation to help get blood flow. Why is that important? Well, it's important because over time, if you lose circulation to the lower extremities, especially in a diabetic, then you're going to lose the ability to heal. If you have a cut on your foot, and the risk of amputation is much higher in people who have diabetes and poor circulation, especially of the lower extremities. And then secondly, the other question that I would want to ask is, if you have poor circulation in the leg, the question is there circulation problems elsewhere in the body? Coronary artery blood flow, or blood flow to the kidney, for example. So those are the things that, that we would want to look at. So Ted, thank you for calling. That's a very good question. But just the fact that you feel a little itchy sensation, cool extremity in the diabetic, those are the things that really tip me off to say, I would give your doc a call and try to get in to sort this out, because there may be something that they can help you with. So any other questions there?
Yeah, we've got, let me see here. Lillian Coulter from Mesa says, within the last 3 days, she has had 2 lumps under her left arm appear. They feel like cysts or large zits or pimples. They seem to be full of fluid, but she cannot seem to pop them.
Okay.
Anything you can tell her about that?
Yes. First of all, please do not pop them. That's probably the worst thing that you can do. It sounds like it's a carbuncle or a little, like an infected boil. Sometimes you can have a sebaceous cyst that's infected. Under the arm is a very warm, area, moist area, and there's a lot of lymph nodes in that area. So if you have an infection, maybe the lymph node is swollen. So I would not suggest, Lillian, that you try to pop that, because you can certainly make it worse. And I've had people come into the hospital requiring weeks and weeks of IV antibiotics because of exactly that, popping or trying to do that in a sterile situation at home, and it's just not possible. If it's tender, and if it's red, and if it's getting larger, certainly it's something that I would want to recommend that you see your doc for, because it's something that probably can be treated very easily with an antibiotic by mouth, maybe even topical warm compresses. That's where I would recommend starting. Keep it clean, get some warm compresses, apply it 3 or 4 times a day. See if you can draw that infection out. And then, certainly an antibiotic would be probably all of it is necessary. Now, the other question is, if it continues and you start seeing more and more of these, certainly, seeking medical attention sooner rather than later would be recommended. If there's certainly fever affiliated with it, that suggests infection. So I would recommend that, that be treated sooner rather than later. Now, one of the other questions that people would ask, well, is this something to be concerned about, like cancer and all this? And if it's warm, if it's red, if it's hot to touch, and if it's painful, chances are this is not, something real bad. It would be more likely an infection. Anything else, Joe? Anybody else calling in there?
Let's see here. We have Baxter from Los Angeles. Very fatigued, tired all the time. 4 or 5 times throughout the day at work, he must take a break or a rest. Very pale and urinating quite a bit, and is not exactly sure if this is a flu coming on or what's going on. But I wanted to bring that up to your attention here, Dr. Borik.
Do we know how old is Baxter?
Baxter didn't say he's from Los Angeles, though.
Okay. Well, let me kind of address this because there's a lot to talk about in this question. Let's talk about fatigue for a moment. And certainly fatigue, feeling tired, out of ordinary. Certainly, we all feel tired at times, and if you're working long hours, feeling fatigued is normal. But if it's out of the context of the normal fatigue that you feel, then it's something that we need to look at. And things to think about. Number one, are you anemic? You said you feel pale. Are you losing blood somewhere? That's something that is very, very real. Look at the stools. Make sure that, if you see black, tarry stools, that would suggest that maybe you're bleeding internally. If you see any red blood, obviously that's something to be concerned about. So, anemia is something that is very, very real, and it directly is related to the feeling and the sense of feeling tired, because you just don't have enough blood flowing in your body. There's not enough oxygen circulating and feeding and nourishing the body. So that's the one thing. Frequent urination is something that the first thing that pops in my head when I hear somebody complaining of frequent urination is diabetes. Do you have diabetes that may not be detected or undiagnosed? And so if you have a family history of it, and even if you can have diabetes, either gaining weight or even losing weight can be a sign of new onset diabetes. And certainly you can feel fatigued and tired with a new onset of diabetes. So that would be something, certainly to look at. I would get in, see your doc, make sure that you get a blood panel, see how your blood work is, and then kind of go from there. But those are the two things that I think would be really important to look at. Thyroid, again, an underactive thyroid certainly can cause sluggishness, fatigue, constipation, hair loss. Those are the symptoms of undiagnosed hypothyroidism, or an underactive thyroid. In the meantime, certainly, you should try to maximize the nutrition as best as you can. Try to get maybe a multivitamin, make sure that you're getting adequate amounts of iron and supplements, because deficiencies of different vitamins can cause fatigue, B12 deficiency, those kinds of things. So that's where I would start in just the assessment, Baxter, as you feel these symptoms. I think it's important to probably get an answer as to why. Any other questions there, Joe?
Yes, we've got Mimi from Yuma. And Mimi says, been feeling very sick for 2 days with vomiting, diarrhea, and just beat. Hot and cold, cannot hold food down. Was in Rocky Point for President's Day weekend. Does this sound like flu, or should I get checked?
Actually, I would recommend that you get checked. And the reason I say that is if you were in Rocky Point, that travel history is something that may indicate that there may be an infectious source to the diarrhea. And, there's different types of causes of diarrhea, nausea, and vomiting. Viral is the most common, and usually it's just self-limiting, where you just, give it a few days, try to keep yourself hydrated. But if there's an infectious pattern or an etiology that is bacterial or that is something maybe that you picked up in your travels, oftentimes that treatment requires an antibiotic. So just the fact that you told me that you were out of the country, would suggest that it probably would be a good idea if after a couple days, if it's not getting better, to get in to be seen. Why is that important? Well, because if this continues and there's a bacterial infection in your system, number one, it probably won't get better soon unless an antibiotic is used. Oftentimes you can get dehydrated, and that dehydration can lead to any number of issues. If you constantly, are vomiting and diarrhea and you can't keep things down, your electrolytes can go off, your potassium can go down, you can have, issues with the rhythm of the heart if your potassium is off, if your magnesium is too low, kidney can be affected by dehydration. So there's a lot of things in the body that are tied to being adequately hydrated. And so that's why it's so important. If anybody feels dehydrated, why is it important to be treated with IV fluids? Well, because if you can't keep it down, it can lead to kidney failure. It can lead to hypotension. You can pass out. You can bump your head. I mean, there's a lot of things that can happen. So I would absolutely recommend that you be seen. And that's a long answer to my answer saying yes. I think it's probably a good idea to be seen sooner rather than later. Any other questions there, Joe?
We do. Beth from San Diego. Actually, you know what? Just looking up here, Rick's out there on the chat. He says, I've heard some athletes and active people have been experimenting with exposure to extreme cold for short periods of time in order to jumpstart weight loss. Does this make sense to you?
It does. And, when you think about the metabolism, I think it all has to do with jump-starting the metabolism in an attempt to lose weight. And so, we know medically that hypothermia, and that's not to get off of Rick's question, but I'm going to get back to that. But we treat people who come into the hospital with cardiac arrest, and we cool them down to hypothermic numbers, to 93 degrees Fahrenheit for 24 hours or so, because the studies show that when we cool the body down, when they're under stress, for example, cardiac arrest, it tends to preserve the neurologic system. It tends to show better outcome from a cardiovascular system. And so, I think there's some schools of thought that exactly are, aligned with what he's talking about in terms of short periods of time in order to jumpstart, the weight loss program. There's a lot of interesting information out now talking about weight loss. And I just want to kind of take a minute because there's a new study that just came out looking at a lot of misconceptions about obesity and those kinds of things. And just, for example, snacking causes weight gain. Eating breakfast regularly prevents weight gain. These are not really medically based facts. And, soon upcoming, I'm going to be posting on the website, on our DocTalk page, some of these facts and misconceptions about weight loss. And so, listeners out there, I want you to kind of keep an eye out on that because there's some really interesting stuff that we think are just, important informational concepts about weight loss. Even the medical community is kind of missing the mark when it comes to treating obesity, childhood obesity, and weight loss. So thanks for that question.
We've got a question from Beth in San Diego. Says, I'm trying to figure out if I have an allergy or just possibly getting ill. When I eat peanut M&Ms, I get hot feeling and sometimes I get a rash. Other chocolates do not do this to me. Beth from San Diego.
Okay, great question. I think that it probably is more an allergy versus illness. And the reason I say that, if it's reproducible, when you eat peanut, M&Ms, and you feel this symptom, chances are you may have an allergy to the peanut. If it doesn't happen when you're eating other, types of chocolate, then I would probably deduce that it might be more related to the peanut, which is a very common allergen. A lot of people have peanut allergies. What I would suggest that you do is maybe do a little experiment. First of all, the symptoms that you're describing are not life-threatening situations. It doesn't sound like you're, having a difficult time breathing or swallowing. So I think that what you may want to try to do is just eat plain peanuts or plain M&Ms, and then maybe just a peanut without the chocolate, and kind of figure out which is it that is really causing the symptom of itchiness and so forth. And then certainly you want to avoid the allergen, because you never know, even though you have a very mild allergy, the next time you're exposed to that, it can trigger what's called a delayed hypersensitivity reaction, and you can have more of a systemic allergic reaction to it. So, be cautious, especially when we're dealing with, peanuts and those kinds of things. Any other questions?
Yeah, I'll be right with you, Dr. Borik, just finishing up.
Okay, good. In a moment, I want to talk about, we might as well take the time now to talk about, personally, I had an experience this past week in talking to a friend of mine whose mom actually has been battling ovarian cancer. And she was diagnosed with stage 4 ovarian cancer, and her docs gave her anywhere from 2 to 6 months to live. We're a year out now, and I had the opportunity of meeting her. And I got to tell you, it's amazing how well this person looks. Now, she was told by her docs that her ovarian cancer had spread and has nodules, and it's affected the whole chest. There's a lot of tumor in the chest area and the kidney and so forth. And when I asked them really what they've been doing, how they've been treated, her oncologist, basically, she was done with chemo. There's no more radiation. There's really nothing else that they really have to offer. So she decided to take part in this protocol, and it's a baking soda molasses protocol. And, as we were talking, I did a little bit of research and found that there's a lot of people who kind of stand by this protocol. And the idea behind it is to really bring an alkaline environment in the body. Cancer cells and, disease processes in the body tend to thrive in the acidic environment. And so if there's a way that we can kind of transform that environment and make it more alkaline by bringing baking soda, along with molasses, which is really more of a sugar base, that, the theory is that the sugar tends to pull out the cancer cells so that, so that they kind of migrate, if you will, out, and then the baking soda, causes the death of the cell. It's amazing some of the reports that I've just, kind of been exposed to this past week or so. But the recommendation is a teaspoon of baking soda, not baking powder. Keep in mind that baking powder has aluminum in it, so that's toxic to the body. So we really are talking about baking soda, a teaspoon with a teaspoon of molasses and a cup of water, and you do that once a day for 5 days, and then you test the pH of the saliva and the urine, and you can get a pH tester from any local drugstore, and you want to keep the pH anywhere between 7.2 to 7.5, because that's when the cells, particularly cancer cells in the body, go dormant. When you raise the pH up to a level of 8.0, that's when lysis occurs, or cell death. And certainly our intention is to lyse any cancer cells that are in the body. And so that's the mechanism and the basis for which this protocol works. And really, as a board-certified internal medicine doc who practices mainstream medicine, certainly I would not recommend a protocol such as this without recommending certain chemotherapeutic recommendations that have been scrutinized and validated in the medical community from research. But I got to tell you, there's probably a lot more to be done than what the medical community is recommending. And this is a perfect example. And boy, it's amazing how well this lady looks, and just stands by this protocol. When you think about it, it makes sense to alkalinize the environment in the body, pull out the cells, and people have been, sworn that prostate cancer has been, halted and arrested and so forth. So I just wanted to share that with some of our listeners. If anybody, has had an experience with this protocol, I'd love to hear from you and, and hear what your thoughts are.
Well,
do you have a question now?
Yeah, Nancy from Bedford, Massachusetts. She had a three-part question here. Can I get my hair dyed safely while pregnant? Also, is it safe for me to get a tattoo? And the last part of the question is, can I lay on my stomach? I am 19 weeks pregnant.
Okay. Let's start with the last. Laying on the stomach, absolutely. Again, the body is an amazing machine. So chances are you're not going to harm, what is happening reproductively within your body by just, postural changes and so forth. Certainly you don't want to, take part in contact sports. You don't, to be injured. But, laying on your stomach is absolutely fine. Tattoo. Just in general, what I want to just kind of talk about the tattoo, whether you're pregnant or not pregnant, there are risks to getting tattoos. And, and certainly most people think that the risk is, dirty needles. And I got to tell you, that's really not the reason that I'm saying that, because most people who, get tattoos done go to, reputable places where the tattoos are, given, in a good hygiene manner. So it's not really the needle that I'm concerned about. It's more the ink. And there's been studies recently that have found that we found that actually in the ink, in bottles that have been, not opened and, right from the manufacturer, that there's a potential for infection, for bacteria to be harbored in the ink. And then when they tattoo the human body, that is transported into the body, and the risk of, developing these different types of infections are very real. So I would be hesitant to recommend and authorize tattooing for anybody under any circumstance from a medical perspective. And that's the reasoning behind it. Now, we do know that there's a higher risk of hepatitis transmitted, via needles and blood transmission. And so, that's something that we always keep in the back of our minds. If I see a patient that has hepatitis, C or B, that is, potentially transmitted via needles or blood, I always ask their history of whether they've been tattooed in the past or if they've ever used IV drugs and that kind of thing. So my answer to that would be I would be very cautious, mainly because of the potential infection that can be given, and not necessarily because of lack of sterile. They can do a perfect job in the technique of, giving a tattoo, but the things that are outside of their control would be the actual ink itself could potentially harbor infection and organisms and bacteria that can be then transmitted to you. So I'd be careful. And then certainly to the fetus. Hair dye, I don't know of any studies, medically speaking, that would say, that you should not, or you should not get your hair dyed or colored if you're pregnant. Now, in general conversation, my recommendation would be if you ever have an opportunity to use a natural product, plant-based, those kinds of things, that would be better than the chemical-based, kind of product. But other than that, there's really no reason why you can't, to my knowledge, while being pregnant. Certainly you can ask your OB. They may have, some other insight to that. Any other questions there, Joe?
Yes, we had a question from Cindy in Tempe. 32-year-old female has had 2 C-sections and wants to get pregnant again and wants to know your opinion on, is that safe to try to shoot for a natural pregnancy after 2 C-sections?
That's outside the realm and the scope of my practice, but my answer to that, just from a general medical perspective, is yes, absolutely. There's no reason why, just because you've had C-sections in the past, why you can't have a natural pregnancy. But certainly that's something that I think would need to be, discussed with your OB and why was the C-section done in the first place? So there may be some other reasons that maybe would inhibit, a safe pregnancy, natural pregnancy, but I don't know. Anything else, Joe? Any other questions?
I've got some lines ringing I'd like to grab real quick here, so be right back with you, Dr. Borik.
Okay, that sounds good. Earlier we were talking about thoracic outlet syndrome and Raynaud's phenomenon and so forth, and I want to just mention a little bit about carpal tunnel syndrome. Anything in the body, any process or syndrome that results from a compression to a nerve. For example, carpal tunnel basically is a compression in the wrist of when the median nerve coming down, through the wrist is compressed. And it results in weakness, sometimes numbness and tingling and irritation of that nerve, and it can be very painful. And oftentimes the treatment of something like carpal tunnel syndrome would be an overuse of that hand can cause an irritation, and the recommendation is to maybe back off on using the keyboard of a computer, for example, or whatever, overuse activity that's causing that. But one more thing that is recommended, in addition to an anti-inflammatory and, certainly, ice or heat or, an immobilizing brace that is recommended, would be vitamin B6. And vitamin B6, in particular, tends to help to regenerate the fiber or the coating around the nerves. So, for example, if you have a thoracic outlet syndrome that maybe, manifests itself in pain in the shoulder or down the arm, sometimes you get what's called a radiculopathy. And sometimes it can cause and exacerbate that vasospasm that we talked about, which is a Raynaud's phenomenon. Vitamin B6 may be something that can help, and it's very innocuous. It's very safe. It's one of those vitamins that you really can't overdose on. There are some vitamins that are fat soluble that you have to be careful. You don't want to take too much. Vitamin A or vitamin D, vitamin E, vitamin K. Those are the fat soluble. But vitamin B is water soluble. So if you take too much of it, you're going to excrete it out. You're not going to have a buildup in your system and become toxic. So it's very, very safe. And the recommendation is like 250 milligrams 3 times a day. And it's amazing how many patients that I've had who really have found some comfort and, improvement in their symptoms that kind of help buy the time, and even, the prevention of surgery if possible for carpal tunnel or for thoracic outlet syndrome. So I just wanted to kind of put that out there. Just keep that in mind that sometimes these supplements can be very beneficial, for the body. Joe, are you there? Do you have another question?
Yes, absolutely. Kelly Sanders from Woodland, I believe she said Woodland, Philadelphia. She says, I'm 50 years old and petrified, never had a pap smear. Is it really that important to get, or can you just go get a blood test and get the same kind of test done with just blood?
No, it's absolutely that important. Now, we used to think that it was important to get a pap smear done every year. And the recommendation, from the, American Cancer Society is, from the age of 21. So Kelly, you're kind of overdue. So I would absolutely recommend, if you've never had a pap, it's important because it's really the only way that we can assess, the cervix to make sure that there's no abnormal cells there. And so, that's really there's no blood test to do that. And if we're thinking in terms of preventative. Now, once, God forbid, somebody has a disease, certainly we can follow tumor markers and those kinds of things via a blood test. But the preventative way to do that, to find, early on if there's any abnormal cells, or, dysplasia or anything like that, really is done via pap smear. And I got to tell you, it is something that, probably should have been done years ago. But, at the age of 50, if it's the first time, it's not too late to get that done, because I think it's very important. Now, do you have to have it done every year? No. I think that probably, a baseline is important, make sure everything is okay, and then, depending on what the gynecologist recommends, every 3 years, every 4 years, depending on family history. Those sexual history, those kinds of things really have a lot to do with it. Any other questions, Joe?
Just finishing up a call here, Dr. Borik. Hang tight just for a second there.
That just lead me into talking about health screening, because health screening is really important, and the purpose and the reason that we recommend certain screenings like colonoscopies, mammograms, prostate exams, pap smears is really to keep the body healthy. Because we know that most, not all, but most problems in the body can be picked up early and can be cured. For example, colon cancer. We're heading into March. March is Colon Cancer Screening Awareness Month, and it is absolutely vital. By the time the body gets to be, the age of 50 or so, the chances of small polyps, growing in the lining of the colon, just like you have little moles on the skin, is very real. They're very benign. They really don't cause any problems. However, there's no way to know if that particular little mole or that little polyp can transform or turn into a malignancy. And so the recommendation, hands down for everybody, by the age of 50, the recommendation is a colonoscopy to make sure, that everything is okay, because, colon cancer is one of those things that absolutely can be prevented if found early. Same thing with mammogram. Mammograms are recommended, and pap smears as well. So, that's very, very important to keep that in mind. And really the benefit that we gain from that, far outweighs any discomfort, which really there's not a whole lot of these days, because it's such an easy technique to do. Joe, are you there? Do you have a question?
You know what? I'm still on the line here, so be right there, Dr. Borik. I'm sorry.
Influenza and vaccinations are another thing. People who, this is the flu season now. We're kind of getting to the tail end of recommending flu shots. So, people even now say, well, we're heading toward the end of February. Is it too late to get a flu shot? The answer is, probably within the next week or so, probably wouldn't benefit you a whole lot. The idea behind the flu shot is to boost your immune system so that you develop the antibodies, so that if you come in contact with the virus, that you'll be able to fight it. The same thing with the pneumovax. Now, the pneumovax can be given all year round, anytime, and the recommendation is for anybody over the age of 65, absolutely should get a pneumonia vaccine. Or anybody that has an underlying chronic illness, diabetes, for example, kidney failure, if you've ever had any malignancy, HIV virus, those kinds of things, because your immune system is a little down, and if you do get exposed to the pneumococcal, virus or bacteria, it can be life-threatening. So the pneumovax is really recommended to boost your immune system, and it's recommended once every 5 years. And so, that is something that again, we recommend mainly for health and maintenance of the physical human body. Just like you take your car in, to get oil changed and to get an overhaul, same thing with the body.
Dr. Borik, I was talking to Melvin. Melvin from Tucson was telling me a story how he's starting an outreach against patches. A 2-year-old grandson apparently almost died from putting on a pain patch, a fentanyl patch, instead of a Band-Aid at a nursing home visiting his grandmother, and almost died. And it was just a warning, if you're on or know anyone on pain patches, make sure they're put away because they're very, very dangerous, he said. Don't know much about those, but that's really it's a great question. And let me just take a moment to talk about the fentanyl patch. It's a transdermal pain system. Is that instead of pills, or
what's that?
Is that instead of pills, or?
Well, yeah, that's exactly right. It's a patch that contains a narcotic, and it basically is a transdermal system where over 72 hours, it's a narcotic medicine that is dispensed through the skin, over a period of time. And so it is a narcotic medicine. It is habit-forming. And the recommendation is really for it not to be used, certainly, in children and so forth. The problem with fentanyl is that it can cause severe and sometimes fatal breathing problems. I mean, it can slow down, someone's breathing to where they actually stop breathing. So, people who are on fentanyl on top of other medications can be a real problem. And especially a 2-year-old who gets, who gets a hold of something like this, it can be life-threatening. It really can be, life-threatening and dangerous. So, if you do have someone in your house that is on fentanyl patches, it looks like a little Band-Aid. And, it's put on, and you think it's just innocuous and it's real, not that major of a deal. But I got to tell you, it can be a life-threatening situation. I've had people come in to the hospital admitted, maybe their doctor may have, placed them on a fentanyl patch just because of ease and not, taking medications by mouth. And I've had people come in almost a comatose state, requiring intubation and requiring life support because, it causes them to not breathe and respiratory distress and those kinds of things. So it can be a problem. The one point that I want to bring out, especially when I think of certain medicines in my mind, there are certain things that I think about. One in particular, if you've ever gotten medication prescriptions from the pharmacy and you've ever been told, not to eat grapefruit or, drink grapefruit juice on this certain medication, fentanyl patch is one of them. And the reason is because there's an enzyme that is found in the grapefruit that prevents the breakdown of certain chemicals in the body. And so what's going to happen is it actually potentiates and it makes the medicine last in the body even longer than it's supposed to last. And so if you eat grapefruit, when you take certain medications, it can actually cause a toxicity effect of certain medications. And fentanyl is one of them. So you've got to be very, very careful.
Got a question from Esther in Mesa, Dr. Borik, who says yesterday her son got in from school and has round sores with like a bloody center in them and wants to know, is ringworm something that's still something people can get this day and age, or?
Oh, absolutely. Absolutely. Ringworm is very, very real. And if it's a well-circumscribed area on the skin, chances are, it may be exactly that. It might be, ringworm. And it's something that is easily treated.
What is it from?
It's just it's actually it's a topical fungus. And it's called Tinea corporis is the name, but it's a fungal infection that it's a microscopic organism that lives on the outer lining, on the outside of our skin. Joe, it's interesting. On our body, there are lots of organisms that live on the human skin and in the human body. And for whatever reason, whether it be a weakened immune system, stress can sometimes do it. You can actually develop this infection on the skin. And oftentimes we treat it with a topical antifungal type cream. And that's the treatment. But yes, it is very real. We see it, this day and age, and it's, often it's very common in the inner city school system. And I think approximately 6% of school children, at any given time can be infected by the ringworm. It's called dermatophytes. It's direct contact with that. It comes from soil, or it can be through exposure to animals, even household pets. So it's something that is very common. It's not real itchy. Usually, you don't really feel pain or anything associated with it unless you have a super infection on top of it. So let's say you have this irritation on the skin and maybe you scratch it, and then you develop your fingernails may not be the cleanest, and you scratch the skin and you cause a little scratch on the skin. You can develop a staph infection on top of the ringworm. So that's something that needs to be treated and looked at as well. Do you have any other questions there, Joe?
I got one last question here. Benny from Mesa says he's had 6 days of diarrhea. Been getting all kinds of people telling him, take this to stop it. Some people don't take this to stop it. It needs to run its course. Anything for Benny?
Okay, diarrhea, basically, we need to find out what the source of it is. If it's a self-limited, cause, for example, if you have, lactose intolerance, or it's from certain things that you eat, maybe you have an allergy to different milks or cheeses, that can cause diarrhea. If you just eliminate that, diarrhea will go away. If it's a true infectious diarrhea, part of what I think people are telling you is that you don't want to really stop the diarrhea if it's infectious, because you want to get the toxin out. And usually that is true. If it is a diagnosed colitis, C. diff colitis, or a bacterial Salmonella, Shigella, any of the pathogens that cause diarrhea, you really don't want to slow the diarrhea down because you want to get the toxin out. On the other hand, if you don't know what the pathogen is, and you have this diarrhea, it probably wouldn't be a bad idea to take, an Imodium, see if it'll slow down, look at your diet, kind of figure out what's going on from that standpoint. If you see blood in the stools in the diarrhea, chances are that it may be more infectious related, and you probably should be seen sooner rather than later. Going on to 6 days, that's pretty long. We're approaching a week. The amounts of electrolytes and fluid loss just within 24 to 48 hours can be huge. And so I would suggest, if you still have profuse diarrhea, that you should probably be seen sooner rather than later. Now, people may say, well, what is profuse diarrhea? Is it, twice a day, 3? If you have diarrhea, more than 5 or 6 times a day, then that would fit the criteria that you probably should be looked at and make sure that it's not a bacterial source. So I think we're out of time. Let me see here.
You know what? We sure are. We're very close here.
Wow, this hour really, really went fast.
Yes, it did.
We covered a lot, and I want to thank those people who called in and who chatted with us, because it's really great. It's a great opportunity for me to kind of hear what you want to talk about, and it really sets me in a position to then talk about certain topics, and so I think that's a great thing. So thank you so much for listening. We'll be back in the studio next week. Don't forget to check out our Facebook page, like us, DocTalkRadio.com. And Joe, I'll see you next week.
Sounds great. Thanks, Dr. Borik, and those of you out there, try to stay dry in this incredible torrential weather we're getting today, as weird as it is out here in Arizona. And thanks for listening to Doc Talk. We'll be back with you next week.
This concludes Doc Talk Radio with Dr. Ann Borik. Till next time, I wish you health, wellness, and many blessings.
Doc Talk Radio is brought to you by Gilbert Hospital and Florence and Anthem Hospitals. Topics discussed are for informational and not intended to substitute advice from your personal physician.
As a small business owner, you need to make every dollar count.